It's not easy being a teen, so you can imagine how tough it is to be a teenager with attention deficit hyperactivity disorder, or ADHD. Our next guest, 17-year-old Grace Friedman, was diagnosed, prescribed meds, and then left to deal with her disorder on her own. After conducting her own research, she took it upon herself to write a digital teen guide for others like herself who suffered from the disease. Please welcome Grace and clinical psychologist Dr. Keith Sutton. Welcome. So give us a quick definition, doctor, of what is ADHD and how do you diagnose it?
Sure. So ADHD is a neurological diagnosis, a disorder, and it affects children, adolescents, and adults. There's a number of aspects to this that happen in the brain where there's less activity, particularly in the frontal lobe of the brain. There's also some other areas involved, but that frontal lobe is really in charge of three main areas. One is it's the mental stop button that says stop, sit still, don't get out of your seat in class. It says stop, don't blurt that thing out. Listen to the conversation, not interrupt. It also says stop and focus on our conversation rather than paying attention to other things that might be going on in your environment, like the TV in the other room or that kid over there talking or so on.
Right.
The second big piece is the frontal lobe helps us get started on things like homework or work or things like that, and also stopping. For folks with ADHD, they oftentimes have a really hard time getting going on something that's not very stimulating, and then sometimes have a hard time stopping something that's very stimulating, like playing video games, for example.
I see.
And then the third main piece is organization, time management. This is also a frontal lobe function, and so this is also an area that's affected by ADHD.
And how does a person, well, obviously you don't want to self-diagnose.
Sure.
So how do you diagnose it officially in
Yeah.
your office?
Oftentimes a lot of people think, oh, I must have ADHD. I forget things sometimes, or I get disorganized. But what we're doing in a diagnosis is, one, doing a good clinical interview to make sure that it's not due to sleep problems or stress or anxiety. And also what we're having folks do is fill out a questionnaire to compare their symptoms to other kids or adults their age. Because what we're actually looking for is, when compared to others your age of the same gender, are you at the 93rd percentile or higher, meaning that your symptoms are higher than 93% of the population. That's when we go into that realm of there's a disorder.
I see. And Grace, you were officially diagnosed at 12, right? But you suspected something might be a little bit wrong, maybe a little younger than that, right?
Yeah. Everything took me a long time to do. Everything was very frustrating, and I noticed something was wrong around the age of 8, but I was diagnosed at the age of 12. And it was a relief to find out that I had ADHD, because trying to put all the puzzle pieces together myself wasn't working. But after I got diagnosed with ADHD, I was immediately put on medication, and that was it. And I was trying to cope with ADHD, and I didn't know what it was, and I looked it up, and I couldn't find anything that was teen directed.
Right.
And I got very nervous. I didn't know what it was. I felt that I was different and that something was going on and I couldn't control it. But over the years, I've thought it would be very beneficial for teenagers to find out what ADHD is, and if they have it, what can they do to work with it.
Right, so you started doing your own research, as you mentioned, and you wrote a 67-page guide, and that's not very daunting. I want people to know. It's a very quick read, and it's written from the perspective of a teenager, and this is probably the only one of its kind, I would think. I mean, you had a hard enough time finding information on your own, right?
Yeah, Embracing Your ADHD was a guide that I wish I had when I was diagnosed. I conducted dozens of interviews and attended scientific lectures and took my own personal experience and relayed that in a teen-friendly way. And it's a guide to take a kid with ADHD step by step, how to understand it, how to cope, and how to thrive.
And I think one of the interesting things, and this might be a question for you, doctor, when I read in Grace's guide that some kids, even when they're on the medication, they may not feel normal, or what we would call normal. They still say, I feel weird. And I think that's a great thing that Grace put in her guide, right? That it's okay and everybody will react differently. I mean, is that what you found as well?
Yeah, some kids report that they experience side effects and that have adjustments for them. Some of them, you know, part of what Grace and I also talked about was that, you know, it's always so important, one, to understand that they might have side effects, but also talking to your doctor or your psychiatrist who's prescribing the medication is so important. And like Grace's guide really points out, that it's really a combination of medication and also coping with the ADHD and learning new tools that it's the most effective treatment.
I think it's really valuable that your guide is something that should be read by parents of these teens too, and not just the teens themselves, because it gives you a kind of an insider's view of what could be going on. Right?
Exactly. My main goal with my guide, Embracing Your ADHD, was to specifically target teenagers with ADHD, something I could not find anywhere else. Not only is it targeted for teens, but it's targeted for parents and teachers and pediatricians and friends and family members that have ADHD. It's able to be read very easily. It's teen to teen, peer to peer, so it's a very easy read, like Dr. Sutton said.
Well, thank you so much, you guys, for being here, Grace and Doctor. To download a copy of Grace's digital teen guide, Embracing Your ADHD, log on to addyteen.com. And to contact Dr. Keith Sutton, go to his website, drkeithsutton.com. Coming up next, super short documentaries about the artists, thinkers, and doers that make Oakland the vibrant city that it is today. Stay with us.